In this podcast, we will briefly re-emphasize assessment of adequacy of CPAP, monitoring while on CPAP, complications associated with CPAP, and how we prevent these complications. Once baby is on CPAP, we expect baby to settle down. Respiratory distress is a main indication for which baby is on CPAP should decrease. Silverman score should read less than before. Grunt should disappear. Along with improvement in respiratory status, hemodynamic status will also improve. Heart rate, capillary refill, and blood pressure should also improve. A pink, well-perfused baby with SpO2 in the range of 87 to 93% and PO2 between 50 to 80 mm of mercury confirms adequacy of CPAP. Success of CPAP very much depends on achieving desired pressure of CPAP and then subsequently maintaining that level of pressure. Monitoring clinical of patient's interface and monitoring of circuit is important in maintaining CPAP at desired level. Respiratory monitoring can be done with help of Silverman score, chest X-ray, pulse oximeter, and if necessary with help of blood gas. Adequate hemodynamic status can be judged with help of capillary refill and a blood pressure. A good bubbling sound on auscultation suggests adequate flow and appropriately recruited lungs. Silverman score provides subjective assessment of respiratory distress. Worsening of score suggests inadequate CPAP pressures which will require further intervention. Baby's tone, activity, responsiveness, anterior front tunnel should be monitored to assess CNS status at regular interval. Adequate urinary output helps in confirming renal perfusion and hemodynamic status. Abdominal girth need to be monitored at regular interval. Chest X-ray and blood gas helps clinician to determine respiratory status of a neonate. An X-ray before putting baby on CPAP will help in determining the diagnosis, while an X-ray after a little while on CPAP will help to determine lung expansion. It should show 6 to 8 posterior ribs on both the sides. Subsequent X-rays are required at the time of acute deterioration or as per individual need. Initial blood gas will help to determine acid bed status of a sick baby. Subsequent blood gases are required as per the need of clinical situation. Patency of airway is of paramount importance in achieving success. Moisten the nads with normal saline or sterile water at the time of each nursing care. If secretions are causing problem with patency of airway, then airway need to be suctioned at regular interval. If required, suction catheter can be passed once at least in each shift. Documenting each observation with help in ongoing assessment of patient as a whole. Such charts are required to ensure smooth progress of a baby while on CPAP. CPAP machine and circuit are simple, but keeping it in place requires good nursing care. Circuit should be monitored for water level in humidifier and bottle for bubbles. Too much of condensation in inspiratory limb suggests inappropriate humidification or excessive cooling of gas in inspiratory limb. If it is there, remove condensed water to ensure linear gas flow within the circuit. Little condensation in expiratory limb should not cause any concern. Bubbling in the bottle should be monitored to assess adequacy of the flow. Absence of bubbling suggests leak in the circuit or inadequate flow. Interface should be monitored at regular interval, particularly to confirm if they are in place or not. A little distance from nasal septum is required to prevent nasal septal injury. A checklist should be in place to confirm meticulous monitoring of circuit and interface by all medical and paramedical staff in uniform manner. The goal of monitoring is to judge the adequacy of CPAP and look for preventing complication of CPAP. Complications are mainly nasal obstruction, nasal septal injury, erosions, pneumothorax, and CPAP belly. Pneumothorax mainly occurs at a time when lungs are stiff in acute phase of the disease. Usually high PEEP level, that too more than 8 cm of water, are responsible for air leaks. High flow can be judged by too much of bubbling, and it can be adjusted to avoid air leaks. It is not common to develop air leaks while on CPAP. High CPAP pressure can also result in decreased venous return, which can lead to decreased cardiac output, resulting in metabolic acidosis. Interface or inadequate humidification related septal injuries are most common complications seen in the babies while on CPAP. This itself are responsible for failure of CPAP. Nasal septal injuries are mainly because of poorly fitted or improper size bronchs. Meticulous attention need to be paid while selecting appropriate size of prongs, cap, and at the time of its fixation. Creams and gels used to protect the skin itself causes excessive moisture locally, resulting in breaking skin integrity, which results in further skin injury. A Tegaderm along with special cannulaid helps in protecting skin of septum and surrounding area. A minimum distance between prongs and nasal septum is desired to prevent pressure over delicate area resulting in permanent cosmetic disfigurement. If not monitored properly, septal erosion can leave permanent mark of poor nursing care of a tiny neonate. A special cannulaid is available in various sizes to protect nasal septum from injuries. Observe the skin over nasal septal area every 30 to 60 minutes for any change in color. At the first sign of hyperemia, prong need to reposition, otherwise it leads to bad erosions. Normal saline or sterile water need to be instilled at each nursing care. Ensure patency. If required, it should be suctioned at regular interval. Injury over skin of the upper lip also can be avoided in similar way with appropriate dressing material and avoiding repeated fixing or removal. CPAP belly is commonly seen while on CPAP. Uniform gas distribution with hostration on X-ray rules out other major pathology. As tone of gastric sphincter is higher than CPAP levels, air will not enter stomach easily. Because of poor sphincter tone in premature baby and high flow required to generate CPAP, abdominal distension is seen in the baby while on CPAP. Baby can be fed while on CPAP and abdominal distension is not a contraindication for the same. Feeding tube should be left open to vent gastric air. Prone position helps in relieving gastric pressure and encouraging baby to pass stool and flatus. Complications like PDA or IVH are not related if CPAP is used in permissible range, that too within 5 to 8 cm of water. Friends, CPAP is a time-tested, baby-friendly device which saves so many lives world over. It looks very simple, but vigilant monitoring is must to achieve successful outcome and to overcome complications. Nursing staff plays vital role for the same.